Most horse owners have heard of the Coggins test, but how many are aware of its purpose? Equine infectious anemia is a dangerous disease that all horse owners should be informed about. Understanding this disease is an important part of prevention. I have worked under multiple vets, and I have studied this disease extensively. I am happy to provide you with the information you need to keep your horse safe. Equine infectious anemia is an incurable infectious disease. According to APHIS, there are 3 phases to this disease: acute, chronic, and inapparent. The acute phase shows only one symptom, high fever, and has a death rate of 30%. The chronic phase is recurring and shows a variety of symptoms, such as fever, anemia, and weight loss. The inapparent phase shows no symptoms and is the most dangerous due to the possibility of it being overlooked. Any horses found to be infected with EIA should immediately be quarantined or euthanized to prevent the spread of this disease. According to the American Association of Equine Practitioners, the quarantine regulations are as follows. Infected horses should be kept in a screened stall that is clearly marked with quarantine, equine infectious anemia, and never be allowed within 200 yards of any other animal. These regulations are in place to prevent the transmission of this disease. According to APHIS, EIA is transmitted via blood or from the mare to her foal. Blood transmission generally occurs due to mosquitoes or other biting insects. These insects bite an infected horse and then transfer that blood to the next horse that they prey on. Because of this, EIA is most common in areas with large amounts of biting insects, such as the southeastern United States. This area is known as the hot zone and is demonstrated in this photo. Transmission can also occur from contaminated needles, which is why it is important to always use a new, sterile needle when giving an injection. Because of how transmissible this disease is, it is important to conduct routine testing. According to the American Association of Equine Practitioners, the Coggins test looks for EIA antibodies in a horse's blood. In order to conduct this test, a vet must draw blood from a horse and then send that blood off to a lab. The vet then fills out the Coggins paperwork, which they return to the owner as soon as the test returns from the lab. This paperwork contains information about the horse and the owner and should look something like this. Another test, the competitive enzyme-linked immunoabsorbent assay test, also known as the C-ELISA test, does exist. However, due to a high rate of false positives, it is rarely used. It is worth noting that a foal may test false positive on a Coggins test due to EIA antibodies found in its mother's milk. Because of this, no law requires a Coggins test on any horse under the age of 6 months. According to the University of Vermont, there is no federal law that requires a Coggins test for the interstate travel of any horse. However, many state laws require a negative Coggins test for any horse to be brought into the state. Many state laws also require a negative Coggins test for any horse to be sold or shown. Federal law is much more strict on test-positive horses, which are banned from transport anywhere except a slaughterhouse. The law does much to prevent this disease, and horse owners can do the same. All horse owners should have Coggins tests done on their horses routinely, regardless of if they intend to travel or not. Any horses found to be infected with EIA should immediately be quarantined or euthanized. In addition, any horses that have had contact or been in the vicinity of a test-positive horse should immediately be tested in order to prevent the spread of this disease. Prevention is key to handling this high-risk disease. Horse owners can aid the prevention effort by understanding the risks and the laws that are in place.